How to make a referral to another specialty. Now, as a junior doctor on the ward, as a foundation year one, two, no matter what grade you are, even as a consultant, you will need to pick up the phone and talk to a friend and get an opinion. Now, at a foundation year stage or a junior doctor stage, you'll normally be asked by your seniors to refer the patient to another specialty. So you could be working in gynecology, and for example, you will need to refer the patient to orthopedics, to surgery, to medics, for example. And it's an absolutely crucial skill to nail. And the sooner you nail it, your life on the wards will be so much easier because you're not going to feel as apprehensive about picking up the phone and speaking to another specialty because you don't know about the patient and so forth. So when a senior asks you to refer a patient, just ask what question they want the other specialty to answer. So, for example, if it's gynecology, trying to refer a patient with abdominal pain, they usually just want a surgical opinion because they may have ruled out all gynecological pathologies. Or, for example, if a patient's got a chest infection, they may want the medics to come and and implement a management plan, for example. So it just means that um, you want to know what the question is because that clarifies it in your head. And being on the other end of the phone, receiving referrals day in, day out, I can tell when a junior knows what they're asking and when they're not so clear. So the must-haves of when you before you pick up the phone to the other specialty is the patient notes. Please keep these in front of you. Do not let any HCA, nurses, midwives take this from front of you. Just keep the patient notes in front of you because you don't know what question the senior on the phone will ask you, and you will need the information from the notes. They may ask you, how long has the patient been in the hospital? What did they initially come in with? So you don't know what question is coming. So just keep the notes in front of you because then you can answer any questions that are thrown at you. The observation chart of the patient, very, very, very important because this helps the senior to decide whether do I need to come and see the patient like at this moment in time or can it wait? The prescription chart to see what antibiotics or what treatment is the patient already on, and they may ask you to start the patient on something which may interact with other drugs. So you need to know what medications the patient's already taking. The scan reports, if they've had any scans, usually surgical patients come in and have a scan done, and from the scan there's an incidental finding of something which then requires another specialty input, which is why the junior gets asked to refer the patient. So just have the scan report handy because then you can just read out the report and that saves you from trying to remember things or trying to get it wrong. The blood test results, so what's the CRP, what's the white cells, what's the HB? Again, that information will then help the senior to decide how urgent is the referral, and also they may want you to start some treatment anyway, and this will be based on the blood results. Now, when you're about to pick up the phone, always when you've been put through to the other specialty, say exactly why you're calling. So, I am so and so. I'm a foundation year one doctor. I'm ringing from the gynae assessment unit, and I would like you to come and review a patient. I would like you to give me advice about management for this patient. I have got a question for you that I would like you to answer. So just explain the reason why you are ringing them. That needs to be the first line after you've introduced yourself to the senior. You then It's very common mnemonic that's used in healthcare settings, very very widely used by nursing staff and doctors, and it's called the S bar handover. So you explain the situation, you explain the background, the assessment, and then you give your recommendation. So in a scenario where you're trying to refer the patient to another specialty, you'll say things like, um, I have a patient who is 52 years old who was admitted to the gynecology assessment unit 2 days ago with abdominal pain. Now this is the situation. So she's on a gynecology ward with abdominal pain 2 days ago. That's it. That's the situation. The background would be she has got, she's known to have an ovarian cyst. We did a CT scan for to assess the cyst further. This scan has now shown, for example, dilated loops of bowel. Then the assessment would be she is currently stable, her observations are fine, she's been given some analgesia, but we would and then the recommendation would be, but my reg would like your opinion on these dilated loops of bowel, and if you could please come and assess the patient for me. So that's it. That's your referral done. So you just explain a bit of the situation. Where are you? Whereabouts are you? In what situation are you calling the other person? Are you in a cardiac arrest situation? Are you in a completely controlled environment where the senior has got a bit of time and they can discuss the patient with you? And sometimes the other specialty senior may be able to give you information just over the phone. They may not need to come and assess the patient. So by giving them the right information, you are then making sure that they act appropriately. So if your referral is urgent, you will say things like, I am calling to refer this patient urgently to you. She is 52 years old. She's on a gynecology ward. She's come in with acute abdominal pain. She's got a peritonitic abdomen. And then you will go through the rest of the thing. So those words, peritonitic abdomen, acute abdomen, she's unstable, would then highlight to the senior that you need to come and see the patient right now. And if you bring in your assessment things like the observation, the blood test for the patient, if they're really abnormal, again that would highlight to the person that this is an important and urgent referral. Then please document. So if you have done a referral to a specialty, please write down the time and the date when you did so. Explain to them who did you speak to, so you can say things like referred to a surgery, discussed with surgical reg, advised by surgical reg, so and so. So whatever they advise. So they'll come and review the patient, or they don't need to review the patient right now because the patient is stable. If things change, to call them back, or they might want further scans. So write down what further scans have they advised. Write down the name of the surgical reg, if you can, if you did get the name, because again that helps to then track people down and rediscuss things if there is need for it. And some tips, because I've done these referrals for a long time and I do receive these referrals on a regular basis. Sometimes you're unable to get hold of the registrar, who's the person you're trying to refer commonly to. So it could be an orthopedic reg, it could be a um, surgical reg, it could be a gynae reg. You could try the SHO. So what I don't want you to do is sit there and bleep the gynae reg 10 times and just keep bleeping and waiting for them to reply, because they might be in theatre, they might be busy with a really unwell patient. So you don't want to just sit there and waste your important time when you could be doing other important things. So try the SHO, because sometimes bleeping the SHO can just, you can just ask them, oh, I'm the surgical SHO, or I'm the medical SHO, I'm trying to get hold of your gynae reg. Would you know where they are? Can I leave some details of a patient with you? Would you be able to pass them on to your gynae reg? And so forth. Try the ward. So for example, if it's a surgical referral you need to do, you can try the surgical assessment unit. For gynecology, you could try the gynecology assessment unit. For an obstetric reg, you could try the maternity assessment unit or the labor ward. You're more likely to find these registrars in these places. Always be polite in your referral, because you don't know what's going on the other end of the phone. Yes, your referral to you is the most crucial thing at that point in time, but it might not be for the person who's listening on the other phone. And by being rude, or by just you just need to let them know about your patient details. That's really it. You don't need to command anything or instruct anything, or have any of those behaviors. And if you have any problems, so for example, if the senior is being obstructive or is being rude to you or has put the phone down, escalate the problem. Don't try and get involved into the politics and trying to resolve things, because firstly, um, you may not be able to do it at your stage, and you may have other jobs to get on to. But if you have any problems, just let your seniors know so that they're aware of what the problem is, and they may just pick up the phone for you and do the referral instead. That's all really. It's not a difficult job, but the sooner you get to the crux of it, the easier and better for you, because it just avoids any problems for you. So if you haven't got the right information for making the referral, the a person at the other end of the phone is more likely to hang up on you, or ask you questions in not a nice way. So you just want to have all the information right in front of you. So if they were to ask you any questions that you thought were unexpected to you, but it might be very relevant to the senior, then that's all in front of you, and you can relay that information with absolutely no problem. I hope this was useful to you, and if you did find this useful, then please subscribe to my channel and like this video and leave a comment about what you thought was the most important tip for you.